Cleveland, Ohio is known for many things: 3 Major League sports teams, a world-renowned symphony orchestra, and of course, the Rock and Roll Hall of Fame. But in the medical world, the city is synonymous with one institution.
Welcome to the Cleveland Clinic.
Every year, nearly 6 million patients, 153,000 of them inpatients, and about 1,500 of those from abroad, come to this hospital system. These patients fly over great hospitals in Europe, New York, Philadelphia, and other places to get to Cleveland. The question is why?
This is a common question that comes, that why should I come to Cleveland Clinic and not go somewhere else? The difference is several-fold. It's not just the doctor, but the infrastructure, the facilities, how to deal with the complications, surgeons, anesthesiologists, imaging doctors, all of this, even residents and fellows, are all critical element for their care.
The $6.7 billion nonprofit system was founded in 1921 by 4 physicians. Its doctors have pioneered coronary angiography, kidney transplantation, coronary bypass surgery, and the first U.S. face transplant. It has a deep bench and a focus on multi-specialty teamwork that particularly includes nurses.
I'm Kelly Hancock. I'm the Executive Chief Nursing Officer for our Cleveland Clinic Health System, which means I'm oversee all the nursing practice for our organization, which includes our hospital in Florida. The Cleveland Clinic is comprised of where we are today at our main academic medical center, and it is a 10-hospital system. Our main academic center where we're sitting at today has about 1,400 beds. We have over 100 ICUs in our main campus, as well as over 100 OR beds. As far as our other hospitals go, we have 2 large academic teaching hospitals, being Fairview Hospital, which is on our west side, and on our east side we have Hillcrest Hospital. The rest of our other community hospitals really have a specific focus to meet the needs of the community.
Many of those patients are heart patients. Cleveland Clinic has long been recognized as one of the premier heart hospitals in the U.S. Cleveland Clinic was the first U.S. hospital to perform a procedure known as TAVR, transcatheter aortic valve replacement. Dr. Samir Kapadia was on that team.
So in Cleveland Clinic, we did our first case in 2005, May. Most of these patients were not even referred to cardiology or cardiac surgery because the referring doctors thought that this is impossible.
TAVR is now widely accepted, but before Cleveland Clinic pioneered the procedure in the U.S., it was a different story.
What is futile and what is not futile? We did a 104-year-old gentleman to replace the aortic valve, and he still works. He goes to his job and he does. He's mentally there. He is socially participating in all the events, and he says that he's out of breath and he cannot function. So he's 104 chronologically, but he looks good. And how can we say no to him?
Offering the latest treatments goes hand in hand with performing research. We asked Dr. Walid Saliba to talk about the latest in treating atrial fibrillation to prevent strokes.
I'm Dr. Walid Saliba. I'm staff at the Cleveland Clinic Foundation. I'm member of the section of cardiac electrophysiology at the Heart and Vascular Institute here. I am the director of the Atrial Fibrillation Center at the Cleveland Clinic, and I'm also the director of the electrophysiology lab. That is actually one of the devices that was recently approved by the FDA. It's called the Watchman device. This device actually is used to occlude the left atrial appendage in patients who suffer from atrial fibrillation. This is not a device that tends to capture clots as much as it is a device that jails the clot in the left atrial appendage, which is the main source of the clots in patients with atrial fibrillation. Traditionally, patients who have atrial fibrillation, to reduce their risk of stroke, are treated with anticoagulants. If you take 100 patients who need anticoagulation because of their atrial fibrillation, right now I would say around 10% will probably go for this device or will be candidate for this device. That's a big market. Atrial fibrillation is a big market. There's no question about it. It is estimated that close to 6 million patients have atrial fibrillation in the US, and It is estimated that this number will double within the next 20 to 25 years. We're very excited about it.
Cleveland Clinic specializes in critical care medicine, but it is ranked high in 10 specialties. One of those is neurology. In this unit, specialists monitor dozens of patients with epilepsy, not just in Cleveland and other Ohio facilities, but in its Florida hospital. In a few months, specialists here will also be keeping watch on patients in Cleveland Clinic's new facility in Abu Dhabi, 6,000 miles away. Teams in all those facilities can respond instantly when they are alerted a patient is having a seizure. Some of those patients are benefiting from treatment with new laser techniques.
So my name is Jorge Gonzalez Martinez. I am a neurosurgeon. I am specialized in epilepsy surgery. That's what I do for a living. I probably do around 250, 300 surgeries a year. In the last, I believe, 5 to 6 years, we have a new exciting technique that's being popularized here in the United States. It's a laser ablation for the treatment of epilepsy. The advantage of the laser is this is done through a little tiny incision. The patient will leave the OR with a small stitch and they can go home the next morning. We had specifically one boy who had a completely normal MRI. If I tell you you have a normal MRI, those are good news in general, but not for epilepsy. So we need to put electrodes in the brain to try to find out exactly what part of the brain is responsible for the seizures. And for this little boy, we found an area in the brain. We implant this patient with SEG electrodes, which is another minimally invasive approach where we put little tiny probes inside the brain. And we localize a little tiny area in a completely normal MRI. So we went there and we follow the electrode that was recording the seizures with the probe. And we perform a little tiny lesion. We're talking about less than 0.5 centimeters. This patient that was having 100 seizures per day completely became seizure-free, and we have now an outcome of approximately 6 months.
The hospital system's mission statement goes back to its founding more than 90 years ago: to provide better care of the sick, investigation into their problems, and further education of those who serve.
We recently opened up Cleveland Clinic Abu Dhabi. Cleveland Clinic Abu Dhabi has 300 beds and it is 4 million square feet in nature. Primary focus is on Heart and Vascular Institute and oncology at that hospital. It was an opportunity that presented itself to us, and it was for a way for us to really bring Cleveland Clinic into a different country and really expand from an international standpoint. So it's a very dynamic, it's innovative. I think it's fast-paced. It's exciting. I've been here for 23 years as an employee. I've done a caregiver, I should say, because everybody here at the Cleveland Clinic is referred to as a caregiver, and they do believe that. So I've had the wonderful opportunity to experience firsthand and all those things I described, being part of a dynamic, innovative place that really puts our patients first and really values the contributions of our caregivers in meeting those needs of our patients.
There are 12,000 nurses among Cleveland Clinic's nearly 43,000 employees. Another 3,300 are physicians and research scientists. Then there are workers like David Moore, often the first person a new arrival will talk to, and that's what he likes to do.
The patients, assisting the patients is the best thing about this job.